I'm going to begin recording our session. Gaitawas Drusha, Gaitawas Tawashrap Sehopa, Wahene Mehuga Yapskayutse Oshra Chanoshta. Good morning and welcome. It is with great honor and great pleasure to be with you all here today for our Four Winds Diversified Project webinar titled Doing Business with the Indian Health Services while capitalizing on the Buy Indian Act. My name is Russell F. Pedro. I currently serve as the Senior Certification and Training Specialist for the Four Winds Diversified Project and President and CEO of Data Management of New Mexico. Before we start, I would like to acknowledge that we have over 90 registered participants here today, representing 23 states to include New Mexico, Arizona, Colorado, Texas, Arkansas, South Dakota, Colorado, California, Georgia, Oregon, Nevada, Oklahoma, Mississippi, Minnesota, Washington, D.C., Florida, Maryland, Wisconsin, Tennessee, Montana, Michigan, and the Navajo Nation. Again, Gaitawas Drusha. Welcome all. We hope that you are all happy, healthy, and safe in your respective communities. The overall mission of all of our Four Winds Diversified Project webinars are to get you as the contractor ready, prepared to bid, market, and meet with federal procurement buyers, as well as prepare you and your company for government contracting vehicles. I do have a couple of webinar housekeeping duties I would like to announce. Again, as mentioned at the bottom of your Zoom webinar platform, there is both a Q&A dialog box and a chat box. Please use the Q&A dialog box to ask questions. Again, we encourage you all to have and ask questions. You don't know what you don't know. And at the very end of this webinar presentation, we will read and answer each question to our team and panelists. Your feedback is very important to us, so please fill out the end of the webinar survey, which will be emailed to you after our event. And please silence your phones, and thank you for your participation. Today, our Four Winds Diversified Project team would like to welcome and thank in advance Mr. Santiago Almaraz, who is the Director of Office Management Services and Head of Contracting Activity with the Indian Health Services, for joining us today to share his in-depth knowledge and advice on doing business with IHS. Thank you, Mr. Almaraz. And as mentioned, we do have a great agenda for you. We will be discussing IHS's missions, goals, and priorities, as well as what IHS buys, what is the Buy Indian Act, and the final rule. We will be going over why it is important to use the Buy Indian Act, the definition of an IEE and an ISB, and of course, the opportunities that are located in our general area. So again, thank you, Mr. Almaraz, for joining us. So who is the Four Winds Diversified Project? Since September of 2019, we've operated in the Southwest region and branded our operations the Four Winds Project. This project was conceptualized by Southwest Business Development Consultants and Data Management of New Mexico and is currently funded by the MBDA Department of Commerce. We are currently in our third quarter of our third year and are located at the Indian Public Cultural Center in Albuquerque, New Mexico. So for those who are in the area, those who are in the city would like to visit us, come over to our offices. We'd love to meet with you and learn more about your company. The Four Winds Diversified Project provides the following services and resources. We are here to provide federal contracting strategies, training, and coaching, assessments and certifications for federal set-aside programs such as the SBA's 8A, Hub Zone, Women Owned, Service Disabled Owned, and even the Navajo Nation certifications 1 and 2. We are also here to provide quarterly training, as well as meetings and consultant services. We are also here to provide access to capital, access to opportunities, and access to referrals. And the very beautiful thing about this is that there is no cost for our core services. So join us. We welcome you as new clients, and we look forward to working with you all. The Minority Business Development Agency was established in 1969 and is the only federal agency solely dedicated to the growth and global competitiveness of Native American and minority-owned companies. New Mexico was one of the first MBDA business centers to open its doors nearly 52 years ago, and today there are over 44 business and specialty centers throughout the United States, including Puerto Rico. Our Four Winds Diversified Project is honored to be part of 13 American Indian, Native Hawaiian, and Alaskan Native grantees, and as mentioned, part of a larger 44 nationwide business, specialty, and manufacturing centers, who some are present with us today. So welcome, MBDA family. We currently serve over 180 clientele, of which 77% are Native American owned and operated. Our clients range from construction to IT, to media, to marketing, consultants, healthcare, real estate, renewable energy, hospitality, insurance, engineers, architects, web developers, software developers, nonprofits, and tribes. We have clients nationwide from as far as New Mexico, DC, Florida, Oklahoma, and Nevada. So, for those organizations that are not clients who are looking for teaming partners or partners, we welcome you to give us a call or email us, and we'll be happy to, share and showcase some of our clients. Over the last 2 decades, our Four Winds Diversified Project team has built a powerful network of over 80 resource and strategic partners, not only here in New Mexico, but the Southwest and nation. We currently work with our strategic partners to enhance our procurement capabilities, to offer unlimited access to contract opportunities on all levels, federal, state, local, including by Indian set-asides. As mentioned, the overall mission of our webinars are to get you contractor ready to bid, to market, and to meet with federal procurement officers, as well as prepare your organization for government contracted vehicles. And as you can see, we've done many and different types of webinars, all focused around the federal procurement area in ways that we can access opportunities. As this past May, we did work with Mr. Adolfo Vasquez, who was able to share with us on how to market with the Department of Defense, the Big Five, and Fourth Estate. And we do have access to all of our webinars on various platforms, including our YouTube, as well as our website. So for more information, please reach out to myself, Mr. Peacock, or Ms. Jones. Team introductions. First and foremost is Mr. Michael D. Peacock, who currently serves as the CEO and President of Southwest Business Development Consultants and is our project operator for the Four Winds Diversified Project. Mr. Peacock, the virtual floor is yours.
Thank you, Russell. On behalf of the Four Winds Diversified Project, I'd like to welcome all the 90 participants from 20 different states. That is incredible. I am honored to be the operator of the Four Winds Diversified Project, and honored to say that I have over 31 years experience in consulting. I've been in business now for over 25 years, and I've been supporting MBDA programs for over 25 years. I'm also proud to say that I am a graduate of the 8A program in 2018. I welcome you as a client to engage with our program, and happy to provide my expertise in utilizing partnerships and joint ventures to position your company to obtain federal government contracts. Again, thank you to our participants, and at this time I'll turn it back over to Russ Pedro.
Thank you, Mr. Peacock. Thank you, Mr. Peacock. Next, we have Ms. Darla M. Jones, who currently serves as our program manager for the Four Winds Diversified Project. Ms. Jones also currently oversees all of our business inquiries, and she is the main point of contact for the Four Winds Diversified Project. Ms. Jones, the virtual floor is yours.
Good morning, and thank you, Russ. Yes, I'm Darla Jones, and I'm the project manager. And just like Russ said, I'm also the point of contact. So if you have any questions or would like more information about what we do here, feel free to reach out. Thank you to our participants, and thank you to Santiago for taking the time out of your busy schedule to be with us today. Much appreciated. And everyone, I hope you find this webinar to be informative, and yeah, enjoy your day. Thanks, Russ.
Thank you, Ms. Jones. And at the very end of this presentation, as I mentioned, we will have all of our contact information, Mr. Peacock, myself, and Ms. Jones information. And I apologize, Ms. Jones, for not putting your information up there. We will also have by tomorrow morning at 11, all of our emails and contact information, including our presenters' information, emailed directly to you. Last but not least is myself. As mentioned, my name is Russell Pedro. I currently serve as the Senior Certification and Training Specialist. And I'm also the President and CEO of Data Management of New Mexico. I've been very fortunate and honored to work with several minority Native American owned companies, Native youth, nonprofits, tribal organizations over the last 17 years here in New Mexico, the Southwestern nation, through past affiliations with the MBDA Business Center Santa Fe, the American Indian Chamber of Commerce, and the American Indian Alaskan Native Tourism Association. During that time, our team has had the honor to host 10 minority and Native American economic summits, 5 meet and greets with our local national laboratories, and 3 one-on-one buyer-seller procurement fairs. All of our fairs, all of our conferences, all of our webinars are all focused on assisting our small businesses and tribal communities. My personal motto is access to capital plus access to opportunity equals job creation and community and economic development. And as mentioned before, for those who aren't client of our Four Winds Diversified Project, we welcome you to contact us. We will also reach out to you to join us to learn and how ways we can partner with one another. Okay, as part of today's webinar, we will present strategies for you to consider before you market to government agencies such as the Indian Health Services, or with meeting with buyers to include the very following important updates. As mentioned in our last few webinars, all the way back, I would say 3 webinars ago, we mentioned that this database, the System for Award Management, SAM, it is a critical tool used to identify and determine buy Indian set-asides and contracts. So not only do buyers use this tool, but also you as the seller can use this tool to also find partners, potential subcontractors. But we need to make sure that this database is updated to include your core data, addresses, phone numbers, emails, fax numbers, your points of contact. You need to make sure that your registration is active and that you are able and have the ability for individuals to search for you, to make sure that your SAM search authorization is yes. It averages, it takes a while to get through this system, but it averages anywhere from 24 to 48 hours to update the system. So make sure that this database is active and updated consistently and constantly. The next is the SBA ProLeak profile. For this database, it's mainly geared toward SBA, but I would still like you to continually update this database. Again, addresses, phone numbers, emails, contact individuals, capabilities narrative, NAICS code, product service code, keyword searches. Constantly, again, make sure that you're updating these databases regularly, monthly, every time you get a new contract, every time you get a new work order. The third main theme is updating your statement of qualifications or qualification statement. I'm going to drive this. I'm going to keep continually driving this into your brains Now, this is also important. Like a business plan, your statement is a living, breathing document. Need to update your statement every time you have completed a new project or a new contract. Again, NACE codes, product service codes, certifications. You will have different statements for different agencies, different buyers, and different contracts. It'll change dependent on your targeted agency. So your SOQ may look different from your IHS compared to your DoD, Department of Defense type of statement of qualification. Because each agency has their own mission and focus. You know, for those who do attend procurement fairs, you can pick up, you know, listings from, this is an example from Northrop Grumman. You can pick up their listings of who you need to contact. Within Northrop Grumman, they have about 20 different systems and managers that you can contact. So again, make sure to do your due diligence and research before you start sending your SOQs out. We do have a great example of an SOQ provided by SWBDC, Southwest Business Development Consultants. And this is another area that we can assist your company in helping you create a powerful SOQ. So contracting resources. Small businesses interested in pursuing federal contracts have many options available to represent their company to potential buyers, to research the federal marketplace for available opportunities, and to understand your competition. To better prepare a business for federal contracting opportunities, it is important to understand these resources. Again, there's OSAM, System for Award Management. There's the Dynamic Small Business Search Engine. I did get a, it was brought to my attention by Mr. Adolfo Vasquez that FedBizOps is no more. That has now been moved to sam.gov. More databases. Of course, last month we did talk about GSA scheduling and schedules. We do have the Federal Procurement Data System, and again, usspending.gov. Again, you can research your competitors, you can research potential partners, you can research opportunities using these different databases. Without further ado, so thank you for that portion. Without further ado, it is with great pleasure to introduce Mr. Santiago Almaraz, who is a member of the San Carlos Apache Tribe, who currently works with Indian Health Services as head of contracting activity and director of office management services. As director of OMS, Mr. Almaraz provides senior leadership and advisory services to IHS acting director and senior management staff in the areas of grants, acquisitions, asset management, administrative and emergency services, policy and regulation management, and executive secretariat support. Mr. Almaraz brings a great wealth of information and small business procurement strategies, and he also has a great team nationwide. Our team here at the Four Winds Diversified Project looks forward to establishing a strong partnership and working relationship with you, sir. Thank you for your time. The virtual floor is yours.
All right, thank you, Mr. Pedro. Good afternoon or good morning. Welcome and thank you for attending today's webinar, Doing Business with IHS While Capitalizing on the Buy Indian Act. Next slide. As Russell mentioned, my name is Santiago Almaraz, and I'm a member of the San Carlos Apache Tribe located in Eastern Arizona. And I am the Indian Health Service Director for the Office of Management Services, as well as the agency head of contracting activity that oversees the agency's acquisition functions and processes. My position allows me not only to ensure that IHS complies with acquisition policy and regulations, but also allows me oversight on policy direction and coordination to include the Buy Indian Act. I'd like to take a quick moment to thank Mr. Russell Pedro and the Four Winds Diversified team for inviting me to speak today on this important topic. Today, I will be providing a quick overview of IHS, what we buy, as well as a brief acquisition forecast of current and forthcoming acquisition opportunities available in the Albuquerque and Navajo areas. Also, I'll provide an overview of the HHS Buy Indian Act final rule and the listing of IHS points of contacts for any questions you may have following today's presentation. And I'll close with answering any questions you may have today in regard to the Buy Indian Act. Next slide. So the next few slides will provide a brief overview of IHS, how we are structured, and the common goods and services we procure. The IHS mission and goal is very unique and special in contrast to any other federal agencies. Raising the physical, mental, social, and spiritual health of American Indian and Alaska Natives. I don't believe there is another mission that includes the address of spiritual health. The IHS goal is no different in ensuring culturally acceptable personal and public health services are made available and accessible to American Indian and Alaska Natives. Next slide. I've listed here a couple of IHS priorities. IHS looks to uphold the federal government's obligations in meeting the IHS mission and goals by continuing to renew and strengthen partnerships with tribes and urban Indian health programs and ensuring improved quality of and access to healthcare. IHS has continued to also establish renew and strengthen partnerships with HHS and HHS sister agencies and those outside of HHS. Next slide. So for those who are familiar with IHS, you most likely know that IHS organizational structure is decentralized, with the majority of our workforce positioned throughout 12 area offices and the network of over 600 IHS tribal and urban managed hospitals, clinics, and health stations. About 90% of our acquisition workforce also operates throughout these 12 areas. And as a quick note, as I will provide more details later in this presentation, the Buy Indian Act does not apply to acquisitions performed by the tribes under the Indian Self-Determination and Education Assistance Act or by urban Indian organizations operating under Title V of the Indian Healthcare Improvement Act. Next slide. I also want to quickly communicate that the IHS acquisition community that include contract staff and FACC certified cores aim to maintain and strengthen working partnerships with contractors and the general public, which include our tribes and their tribal members, and to be transparent and fair when it comes to IHS procurement processes. Our IHS contracting officers and cores work hard each day to ensure IHS procures critical service and supplies while maintaining compliance to federal and HHS procurement regulations and policies. Next slide. So what does IHS buy? IHS procures a multitude of various goods and services. And listed here is a listing of the most common highly procured goods and services to include construction. Typical to all federal agencies, IT goods and services is among the most procured, as well as IHS also procures a wide range of medical goods and equipment, as well as medical professional services for our hospitals and clinics, in many instances located in very remote locations. Also listed here is construction, as IHS does obligate close to $70 million a year in commercial construction. In addition, through the Infrastructure Investment and Jobs Act, IIJA, IHS will receive $3.5 billion for sanitation facilities construction. This is a tremendous win for Indian country when it comes to fully funding the more than 1,500 projects in the sanitation deficiency system. Next slide. So as you all may already know, the HHS Buy Indian Act final rule became effective back on March 14th, 2022. This is another win for Indian country, as the Buy Indian Act is one of the oldest placed into law back in 1910. And this act authorizes the Department of Interior, Bureau of Indian Affairs to procure goods and services from native owned and controlled firms without using the normal competitive process. IHS provides healthcare to American Indians and Alaska Natives, and its authority derives from the Snyder Act of 1921. And through the Transfer Act of 1954, Congress transferred this responsibility and other healthcare functions from the Department of the Interior to the Department of Health, Education, and Welfare, later defined as Department of Health and Human Services. Although the act has been in the books since 1910, it has not been enforceable due to no rules adopted to implement. As briefly touched on earlier, the Buy Indian Act applies only to IHS commercial contract opportunities and the act does not apply to contracts issued and managed with the tribes under the Indian Self-Determination and Assistance Act, also known as 638 contracts, or for purchase orders issued for services obtained through the Purchase Referred Care Program. Next slide. This final rule amends the current HHS acquisition regulations and also supplements the federal acquisition regulations. This rule formalizes the administrative and acquisition procedures for all IHS acquisition activities and locations. This includes all area and service units, which include the National Supply Service Center, which procures a large portion of IHS medical supply needs, and the Division of Engineering Services, which awards most of IHS construction projects. IHS has collaborated and partnered with BIA to finalize this new rule for HHS, in addition to DOI BIA also updating its final rule in support of the Buy Indian Act, which also became effective last month in May. These two actions support the Indian Community and Economic Enhancement Act of 2020 and harmonizing the Buy Indian Act procurement procedures to ensure uniformity. Both IHS and BIA will continue this partnership moving forward and strengthening and improving how we comply with the Buy Indian Act. The Enhancement Act also identifies that each secretary support expanding the Buy Indian Act throughout DOI and HHS. Discussions continue to take place on how HHS can accomplish this moving forward. And more to come on this, as this will be even more encouraging for Indian country that will provide for additional contract opportunities across all of HHS agencies. Next slide. So why the Buy Indian Act? As I mentioned before, this rule is a tremendous win for Indian country by supporting the overall growth of native owned and controlled businesses, which also create jobs in rural native communities and urban native settings to help address high unemployment and joblessness rates in these areas. The IHS, where authorized and practicable, will consider all eligible commercial contract dollars to be set aside for native owned and controlled businesses. IHS fully understands the intent of the Buy Indian Act and wants to ensure that Indian country can benefit from the more than $1 billion in IHS commercial contract opportunities made available annually. This is a substantial amount that can be made available to assist in promoting economic sustainability and development across Indian country. With this new rule, IHS now has the regulated procedures and reporting requirements that support IHS in systematically identifying Buy Indian Act contract numbers. As you may all be aware, SAM.gov system, where federal contractors register in order to become eligible for contract opportunities, does not regulate or monitor when companies indicate they are Native American, American Indian, or tribally owned businesses. I bring this up for a reason. Since the final rule has been implemented here at IHS, we've had some instances where IHS program offices and even contract staff that have relied on SAM.gov and even the dynamic small business search to determine the set aside that deviates away from the Buy Indian Act. I have personally reminded IHS program and contract staff that this is not sufficient and not appropriate. With that being said, I do want to welcome industry, Indian country, and those on the call to question any IHS contract solicitation or opportunity that you feel may have possibly inappropriately deviated away from the Buy Indian Act. At the moment, Buy Indian Act is not an SBA supported program, which means GSA, who operates SAM.gov, does not certify that a company is truly Native American or Native owned or operated. IHS, BIA, and Indian Country will continue to promote the Buy Indian Act with hopes of SBA adopting as a national program similar to what has occurred with VA's Service Disabled Veteran-Owned Small Business Program. Next slide. So the new rule defines an Indian economic enterprise as any business activity owned by one or more Indians, federally recognized Indian tribes, or Alaska Native corporations. In order for an enterprise to identify and self-certify as an IEE, it will need to ensure it possesses and maintains the following criteria. The IHS shall give preference to IEEs through set-asides when acquiring all commercial goods and services. And these set-asides will determine and confirm when the IHS program offices and the CEOs identify there is reasonable expectation of competition among IEEs for a specific acquisition. If there is no reasonable expectation of IEE or ISB competition, or that award cannot be made at a reasonable price, the IHS CEO will move forward and deviate away from the Buy Indian Act. I do also want to quickly note that it does not mean that a CEO will not be able to issue a sole source. The CEO, of course, will determine based on their capacity if they would like to follow the FAR based on issuing sole source award. Next slide. IHS wants to ensure that preference is given to those IEEs that are also small businesses. As you may all know, all federal agencies are required to meet annual small business goals set by the Small Business Administration and their respective Office of Small and Disadvantaged Business Utilization offices. IHS has successfully met and exceeded these small business goals 2 years in a row. For acquisitions that fall under commercial items or simplified acquisition procedures, IHS will set aside exclusively for ISBs. Next slide. So a deviation is an exception to the requirement to utilize the Buy Indian Act. The IHS CEO will document the contract file with an approved deviation if any of the following occur. Each of these instances will require a completed and approved deviation form to be completed by the IHS CEO and reviewed and approved by the authorized contracting official based on the estimated contract dollar threshold. IHS will record, maintain, and report quarterly all deviations to ensure IHS COs and IHS program offices are fulfilling this responsibility. Next slide. So in the previous slide, I mentioned review and approval of a deviation is required, and the appropriate authorized contracting official would be triggered based on the estimated contract dollar amount. This chart identifies the authorized approving official for determination of deviation from the Buy Indian Act. And as you can see, an IHS CEO can approve a deviation for any acquisition exceeding the micro purchase threshold, but not exceeding $25K. And anything exceeding $68 million would be required, would require the HHS OSDBU Director, Office of General Counsel, the HHS Competition Advocate, and the HHS Senior Procurement Executive to review and approve that particular deviation. Next slide. Representation of a business entity that is claiming eligibility under the Buy Indian Act must also do so via self-certification process. This process is in place to assist in identifying responsible IEEs and prevent circumvention or abuse of the Buy Indian Act. To even be considered for an IHS Buy Indian Act contract award, an offer must meet the following criteria to include completing and self-certifying IE status on the IHS designated IE representation form. All criteria identified below to include meeting the definition of an IE must be maintained throughout the IHS contract period of performance. Next slide. So once an IE representation has been confirmed, the IE must meet this definition at the time an offer is made in response to the solicitation at the time of award and during the full term of the contract. A business entity that provides any false or misleading information when submitting a quote or proposal in response to an IHS by Indian set-aside solicitation may be in violation of law. And lastly, an IE representation does not relieve the CO of the obligation for determining contractor responsibility as required by the FAR. IHS has worked closely with BIA in this final rule, and both IHS and BIA understand that the IEE self-certification process needs much improvement, and both agencies plan on identifying and moving toward an improved and possibly automated process similar to the VA Vets First and Vets Biz programs that support the service-disabled veteran-owned small business program. Next slide. To maintain transparency and compliance, IHS will conduct quarterly reporting on the below listed items in connection to the Buy Indian Act. These reporting requirements will not only support IHS monitoring and compliance of the Buy Indian Act, but will also provide tribal leaders, IEEs, HHS leadership, and the Senate Committee for Indian Affairs on how IHS is implementing and complying with the Buy Indian Act. I'm happy to report that for FY22 so far, IHS has already awarded close to $200 million in commercial contracts to Native owned and controlled businesses. With the fourth quarter here starting officially tomorrow, I anticipate this number to continue to increase. Next slide. So here is the following list of IHS contacts you may contact if you have further questions or need guidance on the Buy Indian Act. Mr. Ken Truesdale and I work out of the IHS headquarters office located in Rockville, Maryland. And Mr. John Ferguson is the appointed IHS small business specialist. You can also submit any questions, capability statements, or comments to the designated IHS Buy Indian Act email inbox. Next slide. So I did wanted to provide today a listing of some current and forthcoming procurement opportunities for the IHS. And listed here are it's just a brief listing of some Albuquerque area current and future contract opportunities. I do want to identify that Mr. Eric Wright is the area chief contracting officer there at the area Albuquerque office located there in Albuquerque. And if you have any questions in regards to any of these opportunities, please do reach out to Mr. Eric Wright. You can also ensure that you take a look at the sam.gov to ensure that you see when these particular opportunities become available. Next slide. This list is for the Navajo area, and the point of contact for the Navajo area, the chief contracting officer is Deandra Salabai, and she is out of the Navajo area office located in Window Rock, Arizona. And here is a listing. There is a little more substantial listing here. There's this here, and then also the next slide also provides for additional. I have a complete listing that I will be make available to Mr. Pedro, and he can provide that in his email to you all tomorrow. I do want to also note that these two areas are, I only provided them because of the location and the of that Southwest for Albuquerque, Navajo, but there are 10 other areas that provide for opportunities. And I do want to note that you can access SBCX, I believe it's .gov, and that's the Small Business Customer Experience. And that is where all of HHS agencies, including IHS, upload their forecast, their procurement forecasts, both for FY22 and FY23. We just received a DepSec, the Deputy Secretary of HHS memo this morning, identifying that we will need to have uploaded within the next month all of our FY23 procurement forecast items. So that is communications that we'll be providing to our CCO staff here in the next couple of days. And so you should see those opportunities being made available here within the next month. Next slide. So here are a couple of resources that I made available, kind of some kind of resources on the Buy Indian Act. But I also wanted to note there towards the bottom there is the IHS Division of Acquisition Policy Buy Indian Act site. And that's really our IHS Division of Action Policy webpage. And if you do go to that particular page, you'll go directly to the Buy Indian page, but also within that page is a listing of all of the headquarter and area office contracting officer or leadership point of contacts. Both their email and their phone numbers are made available. So Mr. Eric Wright from Albuquerque, as well as Deandra Salabai from Navajo area, their points of contacts will be available if you click on that link and go to the resources or points of contacts link on that page. Also listed on that page is my contact information, as well as Ken Truesdale and John Ferguson. You can also access the IEE representation form on that webpage as well. Next slide. So again, I want to thank you for attending today, and I look forward to any questions or comments you may have. Thank you.
Again, thank you, Santiago Almaraz, for all of your work, your hard work and dedication to Indian Health Service and our small business communities. We appreciate your time. I would like to now open the floor to questions. We do have a Q&A dialog box at the bottom of your Zoom platform, and we also have a chat box that you can use to ask questions. Again, we encourage you all to ask questions. Okay, so I do have some questions. First one is Kay Bills. She asks, or is it a comment, Buy Indian does not apply to tribal clinics and urban Indian clinics. If so, where do they report their procurements? In the SAM reporting system, question mark.
Yeah, unfortunately, since these particular, the tribal entities that that receives under 638 tribes, they do have the capacity to set aside under Buy Indian Act, but they're not required. The same goes for urban Indian. Urban Indian contracts are awarded under FAR contracts, and so they are a lot of them are cost reimbursement contracts, and so with that, the actual urban, the nonprofit organization, does also have the opportunity to set aside for Native-owned companies. But since their particular contracting staff that include tribal staff are not federal 1102s, and the dollars are a bit different than what we provide when I talk about commercial contract opportunities. That's also those appropriated, made available under the federal contract commercial under the FAR. So those particular dollars, when I talk about over $1 billion, are made available under commercial contract opportunities. There are a lot more other funds that are made available through the tribes and through urban Indian contracts. And it would be nice down the road to be able to tap into those. But of course, for the current final rule, both for BIA and IHS, those particular funds are not required to be set aside for Buy Indian.
Thank you, Mr. Almaraz. I hope that answers your question, Ms. Bills. Of course, you can resend additional questions to our emails. We will have them at the end of this presentation. So thank you, Ms. Bills, for that question. Next question we have from Mr. Will Turner. He states, we see opportunities with only a 3-day turnaround from posting to a response due. I have been told from someone in contracting, this is a way of a contracting officer of getting an opportunity move from a IEE ISB to TSB. When the IEE ISB vendors do not respond in time. Can there be a policy put in place that all opportunities posted will have a minimum of 7 calendar days to submit a response? So that's the first question. So I'll let you answer that. And then
Okay,
there's
so
3 other questions. Yeah.
yeah, so we don't need a policy because this is part of the federal acquisition regulations. You know, when we talk about, we have seen instances where this has been brought up where a particular CEO, IHS CEO will post a source of SOT notice or a solicitation on Friday and it closes on Monday. And so right then and there, that raises the red flag, not only for industry in Indian country, but also for myself. It is required by the FAR for many of the acquisitions that are being issued under commercial contract under the FAR to post it for at least 15 days. So if you do see instances where this is occurring, that's where I talked about earlier about industry, those on the call, Indian country, to speak up and to question those particular solicitations or source of SOT notices where you're seeing that they're in possible inappropriate deviation away from the Buy Indian Act. In those instances, I do want to hold our IHS contracting community accountable. And then when I talk about earlier, I talked about ethical and transparency among IHS acquisitions, and I didn't just put that slide in there just to put there. I wanted to ensure that this is something that we are definitely taking a good look at, especially with this new final rule in place. A lot of our staff, a lot of our program offices are learning the Buy Indian Act. And we have resources. We provided trainings to our staff and to our contracting officers. We have resources that are made available to them. If they have any questions, they can attend seminars like this. I think we have Deandra Salabai from Navajo that is listening in on this particular this webinar. So we have these types of resources and trainings available to our staff to ensure that they understand and how to comply with the Buy Indian Act. Yes, sir, that policy for 7 days is not needed because the FAR already requires that CEO is posted for at least 15 days.
Excellent, Santiago. I'll read the rest of what he had mentioned. He goes, if an IEE or ISB responds within the 3-day window and as asked for an extension, can there be a policy that states the opportunity must be extended 7 calendar days? Either solution will be a huge help to us as we are asked to turn around extensive quotes in a short window.
Understood, sir. Yes, that we understand the time and effort it takes to submit a proposal, to respond to solicitations, and even to source of SOT notices. And so, in the instance that there is a particular source of SOT notice or a solicitation that's being issued, either under IEE or not under the Buy Indian Act or ISB, you can reach out to that responsible IHS CO to request an extension. In most instances, they may be able to, but it really depends on the timing. As we get into the 4th quarter here, we have a lot of contracting officers that have a full plate of acquisitions that they're trying to push through. So it really depends on the situation at hand. Every situation, every acquisition is different. But in some instances, the CEO may be willing to extend that particular opportunity. If, for instance, you see one that's only open for 3 days or a week, then that particular situation, that particular solicitation should be canceled or extended to at least 15 days. If it is 15 days or longer, like I mentioned earlier, it's really determination of that responsible IHS CO on if they would like to extend. In some instances, like I mentioned, there may be time constraints that may be against that they may not be able to extend.
Thank you, Santiago. And thank you, Mr. Will Turner, for that question. Next question is from Wes Hallenburton. Will the slides be emailed? And yes, Wes, for those individuals that have participated today, for those that will like, I will get a PDF version of this presentation converted. So for those who would like the email slide presentation, please reach out to me or put it in the Q&A dialog box, and I'll be happy to write your name down. Thank you, Wes. Next question is from Dan Reese. He says, you mentioned there is a site where we can review that contains future procurement opportunities. What was the site again?
Yeah, it's sbcx.gov. And that's the small business customer experience.
Okay, sbdx.gov.
S as in Sam, B as in boy, C and X
C.
as in Xerox. Yeah,
Okay,
SBCX.
Okay, I believe I wrote that down. I typed that down, sbcx.gov. All right, thank you, sir, for your question. Next question from Joseph Valandra. What efforts are being done to identify Indian vendors? This is an area that has been lacking in the past and impacts the rule of two analysis. Thank you, Joseph. So
Yeah.
what efforts are being done to identify Indian vendors?
So as I mentioned before, it's a self-certification process. And so we are unable to pull vendor listings from sam.gov or from the dynamic small business search. Each area has, and even BIA has implemented their own listings. We've had some discussions recently on how we can improve and start to generate a listing for both IHS and BIA. And we're looking at possibly not a self-certification, but a verification process that allows for possibly a listing where vendors would go in and verify their information. But I also mentioned also having discussions with VA and with BIA with implementing a similar type self-certification process and system where, like VetBiz, that they've utilized to help identify Native, or for that matter, for VA service disabled veteran-owned small businesses. But for by Indian, it'd be IEEs and ISBs. The other piece that you mentioned is, of course, the rule of two. And of course, that's something that has been a question for this final rule for both BIA and IHS. And so, as I mentioned earlier, as long as the CEO can identify that there will be reasonable competition among IEEs and ISBs, then they'll move forward with setting aside under the Buy Indian Act. But in those instances where there may be only one particular IEE or ISB, it is at the discretion of the CEO under the FAR if they'd like to move forward with a sole source award. So there's there are different scenarios for different situations. Like I mentioned earlier, each acquisition is different. But we want to ensure that there is competition, that we can identify that there are at least IEEs and ISBs that can ensure competition and also provide for a reasonable price. Usually when we can't get competition, we can determine that the price is fair and reasonable.
And thank you, Joseph Valandra, for your question. He is currently represents Tribal Communications, and we've been working with them throughout the Southwest. So thank you, Joseph, for your question. Next question, it's basically, please send the presentation to Don. It's Don Johnson. I will send you the presentation. Carlton Hamon, I will also send you the presentation to your email. We got a question from Joy Curvin. She is with Hawtech LLC. which is the exclusive business for the federal government who offers sterilist solutions for regulated medical waste. But she says there aren't any specs written to our technology. Who can I contact about this issue?
Yes, so one of the items that I bring up is a lot of times contracting officers throughout IHS are contacted for opportunities. Sometimes in many instances, there are native-owned companies that identify a specific need or a supply that only they can provide. And so in those instances, you know, we like to try to connect those individuals with our IHS program offices, our clinical directors and so forth. Those are the individuals that write the requirements for our acquisitions. So definitely in this instance, when you're talking about medical waste, it sounds like it's more for our OEH&E, which is our engineering services, Office of Engineering, Environmental Engineering Services here at IHS. And I can provide you with a point of contact that you can reach out to get further information. I could put you in contact with the CEO, but like I mentioned, the CEO doesn't write the actual the specifications. That would have to be someone out of the program offices, and that would be all of our environmental and engineering health services.
Thank you, sir, and thank you, Joy Kervin, for your question. I hope you're able to answer it. Again, for those who have additional questions, again, you can always email them to any one of us, and we'll be happy to answer. Okay. Next question. We have a question from Ms. Dawn Johnson, who is currently one of our Four Winds Diversified clients. She mentioned she's a minority-owned client. I've only seen solicitations for set-asides for Indian firms. Are there any solicitations available or will become available for non-Indian firms, basically minority-owned companies?
Yeah, so we still have our small business goals. So we have women-owned, we have our small disadvantaged, we have small businesses, we have Hub Zone and services able veteran-owned small businesses. So we also have opportunities, as I mentioned earlier, that of course the Buy Indian Act is a good win for Indian country. But as we start to look at the particular the industry under the Buy Indian Act, we're seeing some instances where there aren't native-owned companies that provide medical goods and services. And when I was with Indian Affairs about a decade ago in implementation of the Buy Indian Act under the DOI with BIA, those familiar with BIA know that they do procure goods and services for educational services and for law enforcement. And so when we first implemented the Buy Indian Act at BIA, we saw the same thing. There weren't a lot of native-owned companies that provided those types of goods and services for those categories. But as we began to be more consistent with setting aside those particular entities started to partner and come up through the woodwork in terms of establishing themselves. So right now, because like I mentioned, there aren't a lot of native-owned businesses that provide medical goods and services, and even in some other categories for that matter, when a CEO, an IHS CEO goes out and issues a source of sought notice or does conducts market research, and they determine that there are no native-owned businesses, IEs or ISBs, that can provide for competition under that particular solicitation or acquisition, then they'll deviate away from the Buy Indian Act and set it aside for another social economic status.
Excellent. Thank you, sir. Thank you, sir. And thank you, Ms. Johnson, for your question. We appreciate your question. Okay, next we have Marlena Ortiz. I will send you our recording as well as our slides. Ms. Tammy Smith, I will also send you our presentation slides. Mr. Mr. Watchman, I will also send you our PDF slides. And Ms. Newton, I will also send you our slides. I do have you down. And for those, just to let you know, again, for those who would like to request our copy of our slides, please email me or send it in our chat or question and dialogue box. I'll be happy to send those to you. We will also have this video available on our YouTube website at swbdc.com and then our YouTube page. So it'll more than likely be uploaded by next week. Let's see, I have more in our chat box. Let's see. So it goes, Mr. Will Turner, thank you, Mr. Almaraz, for your answers. Much appreciated and great information. Okay, I do have a question from Mr. Brian Wall. The term micro purchase was mentioned. What is the smallest dollar figure contract that falls under the Buy Indian Act?
So at the present time, we only set aside, we're required to issue commercial contract opportunities and set aside and go through the formal contracting acquisition processes under the FAR for anything above the micro purchase threshold. Of course, anything under the micro purchase threshold is still can be set aside for Buy Indian, but it's not required. Although for our HHS purchase card guide, it does identify that purchase card holders are required to also ensure that they provide for opportunities to small businesses. So we are in discussions with BIA and how we can alleviate that to include the Buy Indian Act for our purchase card holders. So a lot of times we do see, I am seeing that purchase card holders are trying to provide for opportunities for Native-owned businesses. But more of a policy to be implemented down the road is something that we're looking at. And like I mentioned, we're partnering, we want to collaborate with BIA to ensure that, that particular move is consistent and it's harmonized between both BIA and IHS.
Excellent. Thank you, sir. And thank you, Chad, for that question. Brian Wall, Mr. Brian Wall, thank you for that question. Mr. Will Turner, thank you. Chad Hill would like to have the presentation. Jason Wilder, I have you down to get the presentation. David Crawford. David Crawford, thank you for joining us. Clint Estep, I'll also get you presentation. Dan Reese. Ms. Joy Kervin says, thank you, Santiago. Lorraine Rusk would like a copy. Mr. Niels will get you a copy. Liz Isbin will get you a copy. Caroline Taylor, she says, please send a copy and thank you. Andrew Bowers, please send a copy. Thank you for the presentation. It was very informative and they look forward to watching again. Mr. Santiago Almaraz, it looks like we have gone through all of our questions for this session. Some of the main points that I've written down as you were presenting, 70 million a year in construction. With the new infrastructure bill coming through, we got 3.5 billion that's going to be coming down the pipeline for sanitation facilities and construction. 1 billion in commercial contracts annually. Of course, the Buy Indian Act is a win for Indian country, creates jobs. IHS has met and succeeded its goals 2 years in a row for ISBs and set aside with 200 million through third quarter. And go to sbcx.gov for additional opportunities. It looks like I have one more question before we leave, Mr. Almaraz. Who is the CEO for the Zuni Service Unit?
I'm not familiar with the exact contracting official there at the Zuni Service Unit, but you can definitely reach out to Mr. Eric Wright, who is the area chief contracting officer for the Albuquerque area. He'll be able to provide you specifically the point of contact and the names of any of those particular contracting folks there at that particular service unit.
Excellent. All right. Well, I appreciate again, Mr. Almaraz, our Four Winds Diversify Project team. If you have any last few words, departing words, Ms. Jones or Mr. Peacock, you may now state them. Again, we appreciate you, Mr. Santiago Almaraz. I know we had briefly talked, maybe potentially we could do in October, meet to the buyers with IHS, but we can definitely continue that conversation as we continue to move forward. But again, we appreciate all those from across the country for joining us today. Thank you for your participation. As you can see, I am now putting all of our contact information below. Ms. Jones, Mr. Peacock, Mr. Almaraz, your final words.
Thank you, everyone, and thank you, Russ, for putting this webinar together. Very informative. We appreciate that.
Thank you so much, Mr. Almaraz. On behalf of the Four Winds Diversify Project, it sounds very intriguing and very promising for our Native American clients and small businesses. And you know, FAR is very hard to understand, along with the Buy Indian Act. But thank you so much for being available to work with us and explain the Buy Indian Act if we have any questions.
Yeah, thank you, sir. Thank you all for inviting me today to speak on the Buy Indian Act. Like I mentioned before, please do reach out to me if you have any additional questions or comments. Me and my team are here to help and support and ensure that we comply with the Buy Indian Act for Indian country. Thanks.
Excellent. Again, all have an excellent afternoon, a great 4th of July weekend. Be safe, be happy and healthy. For those who would like to get more information, please reach out to any one of us. We would love to sign you on as clients. Please look out for July, August. We will be planning to do working with the BIA webinar. Again, have an excellent afternoon and weekend. Thank you all. Appreciate you.